Welcome back to Coronavirus Central. This is your update for the 15th of March 2020. I never really introduced myself. I just post these videos and you're wondering, who's this strange dude? Well, my name is Daniel Rodriguez. I'm a professor of public health and I'm in the Department of Urban Public Health and Nutrition in Philadelphia at LaSalle University. So these are my credentials. You can certainly look me up if you want. So just a refresher, what I've been tracking here is the prevalence and ever cases of this COVID-19, as it's called, and the change from day to day. So I'm just looking at change from yesterday to today. Prevalence is the number, basically it's the number of existing cases right now divided by the population total. So our population total best estimate is 60,461,000, almost 642,000 in Italy, for instance. And so that's my denominator, and my numerator is the number of active cases for prevalence. So, and this is the proportion for the active cases. P is proportion, Q is 1 minus that. So this would be the proportion that are active the prevalence right now, and then this is 1 minus the prevalence. So these are the probability, in a sense. With any proportion that can be turned into a probability. So this is the probability of not having this horrible condition. Ever is just has anybody ever had it, whether they're recovered or not recovered. And then we have the change. A change is looking at this prevalence from yesterday to today. So let's just take a look at some of these numbers here. So I'm trying to hide from Piper so he's not yelling. I can hear him in the background nevertheless, but I don't know if you can. So right now in Italy, the prevalence per 100,000 people is 29 individuals. That means if you had 100,000 people and selected out of random from that 100,000, 29 of those would have this COVID-19. Ever having COVID-19 in Italy, it's basically 35 per 100,000. The change in prevalence from yesterday to today is there's an additional almost 5 people per 100,000. Compared to Korea, I see no change in prevalence from yesterday to today. And as you know from yesterday, if you listened to me yesterday, I was comparing Italy to France because the populations are very similar in size, and there's a pretty big difference here. So, for instance, prevalence is 29.357 in Italy per 100,000, and it's 6.71 in France per 100,000. And again, I always tell you about the yeah, but people. Yeah, but people are people who want to prove that they're smarter than you are, and because they're trying to poke holes in everything you do just to make themselves look more intelligent. That's my belief. You don't have to agree with me there. But those people will say, yeah, but there's the conditions started later in France than Italy, and it'll be the same. Well, we don't know that. We have no idea. Actually, one of my goals is to really study what happened in Italy, because that's a very interesting case. And we can look at it in comparison to the United States. Who's to say that an individual who was in Wuhan didn't come to the United States before going to Italy? Or an infected person wasn't in the United States before Italy? We certainly have plenty of cities in which we have large population of individuals who would travel to China, whether they're Chinese by descent. So we don't know, but Italy seems to be a very interesting case. In the United States currently, we have, in terms of prevalence, it's 0.875, so close to 1 person per 100,000. That's up by 0.2, about almost a quarter of a person since yesterday. I added some new countries here. This is awesome. So if you looked at these data, you'd see that there's an increase in cases in Canada of 1.72 per 100,000 since yesterday, and this is Argentina and this is Serbia. I picked those countries because those are where my family's background are from. So you say, wow, there's this major increase, but see, you're relying on me to tell you what I did. And I added these countries today, so my spreadsheet does an automatic calculation based on yesterday, and yesterday I didn't do these countries, so they're set at 0, so you see an increase of 1.7169 in Canada, which is equal to their prevalence. So we say in statistics, junk in, junk out. So it depends on what comes in is going to give you the result that you see. If I didn't tell you that, you would think that there was actually an increase in 1.72 cases per 100,000 in Canada. Well, that's not the case. But at any rate, in Canada, there are currently but a little bit more than 1.5 cases per 100,000. Compare that to the United States, it's a little higher actually, see? So US, it's 0.875 per 100,000. So they're a little higher than we are. Now let's go to the cities in the United States again. So we have less than one person increase, basically a person increase per 100,000 for the state of Washington. And yesterday was the first time I included Florida and Texas. I think it was Florida and Texas were like included for the first time yesterday. So they had some minor, slight increases. California, so Washington still is pretty much the worst situation. Although New York is catching up, as you see in New York, there is an increase in basically one person per 100,000. So we got to keep all of this in mind as we're moving forward. And let's see, I think that's all I wanted to say today. I just want you to make sure that you stay healthy, keep on going outdoors, keep that, whatever they call it, personal space or whatever it's, I forgot the new term that's being used. People love to throw out new terms. I don't know what the heck's up with them. But the idea is just to keep your distance, make sure you're washing your hands every day, make sure you're sneezing into your elbow. And as I said before, make sure you get vaccinated. Otherwise, everything that you're doing, vaccinated for things like for the flu or for any of the other pathogens that are out there for which we have vaccines. Because if you don't and you're complaining about what's going on here, you're being a hypocrite. I like calling people out of that. You can call me out as a hypocrite when I don't do things, so I can call everybody else out as well. So please make sure you're practicing good hygiene every day. And for my Norwegian colleague, there was an increase in 1.70 per 100,000 from yesterday. I don't have the latest data, unfortunately, on Oslo. The last time I did that was a couple of days ago. So I'd like to, if you have any data on Norway, send it my way. Okay? Well, thank you very much, and have a safe and healthy day. Bye.